Pediatric Pulmonologist here at the Lilavati Hospital and Research Center. Today I am going to talk to you about a very important and a neglected topic called sleep. So, if you see in today's world, if somebody gets busy, what thing gets neglected? First is the family and second is the sleep. And we really don't even bat an eyelid when we neglect our sleep. How important is sleep? What are the problems associated with sleep deprivation about today? And I'm going to talk to you about how you should train your child to have a healthy sleep, because sleep is the basis of a good mental and physical development. So if you look at what is the requirement of sleep, duration of sleep, and what is healthy sleep. So healthy sleep is if you sleep for adequate amount of time, you get up in the morning completely refreshed. Nobody has to yank you out of or an alarm clock which keeps on buzzing and you keep snoozing and then you need to get up. So that is not done. And you should be fully refreshed through the day for your day-to-day activities. And why me as a pulmonologist is talking about sleep? Because we have a lot of sleep disorders which cause fall in oxygen saturation. So it's very important for a pulmonologist to know about sleep in children and of course in adults as well. So if you look at what is the duration of sleep, it varies from childhood to adulthood. A newborn baby will sleep something like 16, 18, 20 hours in a day. By the time the child is 1 year old, about 10 to 12 hours. An older kid up to 3 to 5 will sleep about 8 to 10 hours, up to 11 hours in a day with a short nap. After age 5, nap is not required. Adolescents need little more sleep. They need about 8 to 9 hours of sleep per day, and adults will sleep anywhere from 7 hours up. That is how the sleep duration which is required for healthy sleep. When we look at the rhythms of sleep, there are two rhythms. One is called the circadian rhythm, which is driven by the light. So if the sun rises, there is exposure to light, we get up. By the time it's late evening, night, it's dark, we feel sleepy, and that's how our body is geared. The other rhythm of sleep are the two cycles of sleep called the REM sleep and the non-REM sleep. To make it very simple, we get into sleep as an adult through non-REM, and then we get into a rapid eye movement sleep, that is the REM sleep. We dream in the REM sleep. We start our sleep with non-REM, we cycle through the night, non-REM, REM, and when we go towards later part of the night, we have predominantly REM sleep. The non-REM sleep is required for physical restoration and the REM sleep is required for mental restoration. Children sleep a little differently. So you must have heard of a proverb called sleep like a baby, because babies get into REM sleep very quickly. And when they get into REM sleep, they're fully fresh and they will get up immediately after 2 to 3 hours and they're very active, much to your dismay, especially when it happens in the middle of the night. This is so because babies get quickly restored and they get up because they have to be fed. Now let me talk to you about abnormalities of sleep. So let's come to infancy. What is very important that parents should know that we need to develop a healthy sleep discipline or healthy sleep hygiene. Today, with the onslaught of COVID, your parents are working from home. They are exposed to screens. Screens inhibit sleep. So they themselves are not sleeping because of work pressure, because of exposure to screen. They are themselves awake till 12, 1 in the night, and so are their children. They get up late because next day morning children don't have to go to school nowadays because there is no school. So they are getting up late. So this is completely destroying the circadian rhythm. What we need to develop is a good healthy sleep hygiene and a good circadian rhythm. And this begins in babies around the age of 5 to 6 months. So by 5 to 6 months of age, babies realize that this is day and this is night. Till that time, they would get up every 2 to 3 hours, irrespective of whether it's day or night. So by the time they are about 6 months of age, they can sleep for 6 to 8 hours at a stretch without getting up for a feed. But the babies might move, might whimper. Parents, because of a force of habit of feeding them every 3 hours, will wake up with the baby, probably feed the baby, rock the baby, or take the baby out for a stroll. But this should not be done after the age of 6 months. So if a baby gets up, just pack the baby there, let the baby go back to sleep, and the baby will go back to sleep. And this is how you should develop a healthy sleep rhythm, so that by the time the child is 8, 9 months of age, the child sleeps like an adult, and so can you sleep. It is extremely important that the baby sleep on time. It's not okay that you sleep at 2 in the morning and get up at 11. The reason is the growth hormone for children is secreted around 11-12 o'clock in sleep, and babies need to grow, and therefore you need to see that they have good sleep habit. A little older child, say 3, 4, 5, you would have noticed that these children don't want to sleep. You take them to bed, they'll run away, they'll make 100 excuses. This is called as behavioral insomnia of childhood. Here, parents need to set limits. They have to be firm and sure. Yes, bacha, you have to go to sleep. Put a nice schedule, read a story to them, dim the lights, no television in their room, so that no screens, very, very harmful for them. And see that they sleep at a regular time, sleep at a fixed time and get up at a fixed time. A healthy, wealthy and a wise baby is one who sleeps on time and gets up on time. When we have older kids, we have certain pathological conditions which are called sleep disordered breathing. So you may have children with tonsils and adenoids, and these tonsils and adenoids, when the child sleeps at night, obstruct the child's airway, and these children start snoring. So if you have a child who's snoring, if you have a child who's getting up in the middle of the night gasping for breath, a child who's sleeping in abnormal postures, this is a baby who's got sleep disordered breathing. It is not to be taken lightly at all, because sleep disordered breathing reduces oxygen supply to all the body parts, the brain. And when these babies do not sleep well, they get up in the morning, they are not fully rested, and they have long-term consequences on everything. So they can have consequences on their mood, they can be irritable, they can have scholastic issues, they can have difficulty in memorizing things, and long-term, if not treated, these children will tend to have blood pressure, they can have heart disease, they can be obese, etc. So, when you suspect a child with sleep disordered breathing, these children need to undergo a study called the sleep study, which is done here at the Lilavati hospital. A study which will tell us how restful the child's sleep was, or how much was the oxygen and the carbon dioxide through the night for the child. Even adults can have this problem, which is called as obstructive sleep apnea. It happens in adults more because of obesity. Post-COVID, we are seeing a lot of children with obesity and a lot of children with these kind of disorders. So please be watchful of these conditions and bring to the notice of your doctor if your child is snoring or having difficulty in sleeping or is getting up in the middle of the night. Many children have something called as parasomnias. What are parasomnias? These are disorders in childhood where the children may get up shouting, screaming as though seeing a ghost. That's a nightmare. That occurs typically in the later part of the night. Here the child is aware, he remembers this in the subsequent day, and you can counsel the child, okay, there are no ghosts, you'll be fine, we are there with you, etc. But there are certain other disorders called as confusional disorders, or night terrors, or sleepwalking, which occur in the first part of night. And here the child has no memory of this event. So whatever you might do to counsel this child or control this child, the child may still be continuously crying and will be completely irritable. Parents, don't panic about this. This will pass with time, and these are disorders which are called as parasomnias. All you need to do is to see that your child is safe, especially if the child is sleepwalking, the child does not hurt himself or does not fall anywhere. There are certain other disorders, like children might complain of leg pains before going to sleep. Something is crawling, something is itching, something is not right, and they want to move their legs. They say, press my legs. It's very, very common. These are called as restless leg syndromes, and this is also very common in childhood. You need to meet your doctor. Probably this could be a deficiency of some iron, and therefore these children, you need to do certain blood tests and come to a conclusion, then accordingly treat them. So parents, we spend 1/3 of our life sleeping. Sleep should be restful. Sleep should be healthy, and foundation of all healthy things starts very early in life. So see that you develop healthy sleeping habits in your children. I'm sure as a child you slept early and got up early, and therefore where you are today you are. See that your children achieve the same. Thank you very much.